Yo, yo, yo. Oh my God, I just got a call right now. That was going on. 1 second, guys. Anyways, guys, so literally as I put I have a call and it like messed up my whole thing. But anyways, guys, what's up? How's it going? Uh, I'm super excited, guys. I'm gonna do the video that you guys all said you guys wanted to see, so I'm gonna do it right now. Let's go. I'm excited because this is actually something that's really personal to me. Because I've had so many injuries in the past, and all of them were learning experiences, and that's what taught me a lot of things that I know today. What's up, George? What's up? Okay, I don't want to butcher your name, but it's he. What's up, Rebecca? How's it going? Hashtag live. So I'm trying to get comfortable in here. Yeah, let's go. Um, Real quick before I start, I just wanted to make something clear. And one of the members brought it up to me, and he was kind of like confused what the group is about. So my intentions with this group, guys, just so you guys know, I'm trying to provide as much free, valuable content as possible, especially to the vegan community. What's up, Kurt? And and only if those people who are looking for like extra help, like one-on-one personal help, then I'm there to support you guys. But really, the goal for me is just to provide as much valuable content and help serve as many people as I can. Because obviously, I'm not going to work with everybody in this group. That's not my goal. My goal is just to help as many people as I can. So I just want to put that out there. Obviously, if you guys are looking for extra help, just let me know. But I don't really care. That's not my intentions here. So really, a couple make sure I got my whole thing going on. All right, cool. So um, basically, my story. I've had a lot of injuries in the past. Like I said before, I hurt my shoulder, hurt my back at a young age, and these things, like I said, they really taught me a lot how to fix them because like when obviously when it comes to injuring yourself, it keeps you from working out, and this is like the biggest thing that I hate the most is like not being able to work out. It literally drives me crazy. I get depressed, I get sad, I just start eating more food. So I don't want you guys to go through what I went through, and that's what I'm about to explain today. I'm literally going to cover the whole body, seriously the whole body, like things like common, and I'm not a doctor here, I'm not a physical therapist, but I'm talking about like common causes of like typical injuries that people would probably sustain, like shoulder, rotator cuff injuries, lower back pain, like herniated discs, stuff like that, neck pain. So let's get started here. You guys freaking ready? Excited. I'm super passionate about this. What's up, Amir? What's up, Kurt? What's up, Melissa? How's it going? Hashtag live. If you guys are watching this live, let me know where you're watching it from. I want to see the engagement. Cool. So first things first. I tell this to all my clients, everybody I work with, like the most important thing you guys need to understand is there's a rule, there's a couple rules. First of all, first rule, mobility versus stability. Okay. So what does that mean? Obviously, like mobility is like your range of motion, how like far you're able to move your joints. And then stability is being able to like have enough muscle where your muscles are strong enough to stabilize a joint. And the biggest problem that I see with people, and the reason why people get injured so often, is because they don't follow this rule. They go into the gym, they have poor mobility, they're really tight from sitting in a chair all day, and then they go work out really hard and lift a bunch of weights, and then they get injured. Well, that's because you didn't follow the rule. You got to be mobile and stable at the same time. But first, before you even work on building strength and building muscle, you need to make sure you're mobile first. So that's what I do with all my clients. I run a functional movement screening on everybody, making sure that their body's functional and mobile and so able to move properly before I even start loading them up with weights, and so that they don't get hurt. That's rule number one. Rule number two is the kinetic chain. So your body there's something called the kinetic chain where basically like one part of your body will affect the other part of your body. So usually if you have a pain, like if you have pain, say in your lower back, for example, the problem isn't your lower back. It's actually probably coming down somewhere from the kinetic chain. It can literally be anywhere from your ankles being tight. It can be anywhere from your hips being tight, and that can cause lower back pain. So every time you guys have an injury or have pain or something like that, uh, don't think about what's actually hurting. Think about what could possibly be causing this problem. And I'm going to talk about this a lot in the next parts that I'm going to be talking about the different parts of the body of like what could be causing these problems. So pay attention. Let's go. First things, this is not a rule, but this is something that I like to practice, and I think it's really, really beneficial, and it's helped me prevented me from getting injured. Foam rolling, guys, myofascial release. Okay, foam rolling, if you guys don't know, foam roller is like that big cylinder block thing that you can find at the gym sometimes. If you don't have one, I recommend you guys go buy one. Seriously, this is like the game changer for me. Um, Foam rolling is basically like giving yourself a massage. And what happens when you work out is your muscles get really tight. And when they get tight, they're more likely to like tear, or that's when you get like a muscle like tears and you pull a muscle strain, same thing. So foam rolling is gonna keep your muscles nice and loose. I hate to use this analogy in a vegan group, but it's kind of like a meat tenderizer. People use like meat tenderizers to make like meat softer or whatever. It's kind of the same idea with foam rolling. You want to basically like make your muscles nice and soft, but also like strong and stable at the same time. So foam rolling, I would recommend everybody get a freaking foam roller. If you guys don't know how to use it, I'll make a freaking live video on foam rolling. It's really I love foam rolling. I do it before the gym, after the gym, when I'm sore. You got to foam roll. You have to, or else you're gonna get hurt. You're gonna pull muscles. That's a guarantee for sure. Obviously, stretching is super important with foam roll. I mean, without preventing injury, but I'm not gonna talk about that too much. So let's talk about the common types of injuries that people sustain. I'm gonna start kind of with the bottom up. So first one is gonna be ankles. Like how many of you guys have sprained an ankle before? I have playing soccer in the past. I don't really do any running anymore, so I don't really hurt my ankles anymore. But ankles can cause a lot of problems. Like I said, literally, if you have tight ankles or you have ankles with problems, you can literally cause like lower back pain. It can probably travel all the way up to your neck. So it's always important to actually focus on your ankles. So there's a couple tests that I use to measure ankle mobility, but basically the same thing with ankles. If you want to make sure, especially if you're like really into sports and you're an athlete, this is really important. You need to make sure your ankles are mobile first. Again, follow the rule, mobile, and then you want to make sure they're stable. So you can do like a lot of like stretching, stretch out the caps. Are usually what you want to do for the mobility stuff, and then the stability stuff. You're gonna want to do like stuff like on a Bosu ball or like one of those pads. I forgot what they're called. I can't even. I just blanked right now. But one of those pads that you can step on and it kind of makes you unstable. Kind of like stuff like that is going to really strengthen the muscles around the ankle. Make sure. Um, sorry, my phone's really loud. Is going to make sure that you're like when you're running and you like land kind of weird, your body's gonna be able to kind of adapt and not actually like pull. I mean, sprain your ankle. Ankles, guys, super important. Remember, everything's gonna go up the kinetic chain. If you start at the bottom and you're having issues, you're gonna have a lot of issues. And that leads me to my next point, the knees. Now, the knees are really complicated. I'll explain to you guys like the normal causes of like knee pain from lifting, but on rare occasions in people who are like usually older and they've been overweight for a long time, people are gonna have like knee issues due to like lack of like cartilage. Everything's like basically you hear like the phrase like bone on bone, where there's like no cushioning between the two knee joints in the knee joint. But that's something you can't really fix, to be honest. Like there's nothing I can tell you to fix your your like bones rubbing together in your knee. But with knee pain, there's a couple things that you can fix if you are having knee pain and you're a young person, you haven't like you're not really overweight, you don't do a lot of running. Like this is why I say don't run all the time. It's not good for your body, and we're not designed to run like freaking miles every day, every day. Horrible idea. But for knees, usually what happens is like if you have overactive quads and your quads are tight, basically it's going to push your kneecap forward, and then you have like undeveloped developed hamstrings. That basically your kneecaps going to be pushing forward, and you're going to have like a lot of knee pain, usually on the outside. It can also be knee pain could be also be caused by like a tight IT band, which you would have to stretch that out as well. I'm not going to go into like how to stretch that out. So one of the biggest things you can do, I'm talking about squats here because I always love squats, always talking about squats. Um, you need to make sure you're getting below parallel when you're squatting, because what happens is like anytime you're squatting and you're not going below parallel, basically you're just activating your quads the whole time, and that's just making your quads tighter and it's pushing your kneecap forward. But when you get below parallel, that's when your hamstrings activate and it kind of pulls your kneecap back, so it kind of gets it in the right position. Like all your joints are super sensitive. Sorry, I'm blanking again. They're really sensitive. Like if you just overuse anything and you have any muscular imbalance, you're gonna have issues, and that's the problem. Usually, the pain and the injuries are caused by muscular imbalances in your body. So you want to make sure your body's like really symmetrical. So always focus on the hamstrings. Honestly, if you want bigger legs, you have to work on your hamstrings because your quads can only grow as big as your hamstrings are. So if there's a certain ratio that basically some math equation, whatever. I'm not gonna talk about that. But anyway, so back to the knee thing, making sure you're squatting below parallel. Another thing when you're squatting, if your knees are coming in, it's called oh my God, I can't even think of any words right now. Um, Knee valgus, there you go. Is when you're like squatting and your knees are coming in towards each other. That's because you're not using your glutes. Again, everything's connected to each other. So if your knees are coming in when you're squatting, you're gonna have knee pain. If you're jumping and you're like jumping and you're landing and your knees are coming in, you're gonna have knee pain. I know a lot of professional football players and stuff and athletes that like literally they could have prevented a knee injury just by correcting their form when they're jumping. Like simple movements, guys. You need to be able to make sure you're able to move properly before you do any of this crazy jump squats, jumping lunges, and stuff like that. Um, so yeah, back to knee pain. Like you need to have strong hips, glutes, because the glutes is what's going to push the knees away from each other and make your knees a lot more stable. So people always ask me, why don't you squat with knee wraps? Aren't you worried about your knees when you're squatting? Squatting is bad for your knees. No, actually, strengthening the muscles around your knees, like the quads, especially the teardrop muscle in your quad, is going to really stabilize the knee and prevent a lot of injury. But obviously, if you guys are like running every day and having a lot of high impact activity, you're eventually gonna have like you need knee replacement surgery, like because our bodies are not designed to be running like that. And then I can go into like, sorry, I know there's a lot of things, but there's like you can also go into like running mechanics. Just realize that like being aware of how you're running and running properly, like running on the balls of your feet as opposed to like landing every time on your freaking the whole foot, which I see all the time at the gym, which drives me crazy. Don't run like that. Run on the balls of your feet and like land softly. Don't just like pound your feet into the floor when you're running. That's a huge thing for all the runners out there. Learn proper running mechanics. That's a huge thing for knees right there. I think I covered everything on knees. Let's move up to the hips now. So what are the hips? When I'm talking about the hips, I'm talking about the quads, the hamstrings, and the glutes. So again, obviously the biggest thing for this is actually because you want to these are supposed to be like mobile joints. You want to focus on stretching. So stretching your quads, hamstring, glutes, making sure you have good mobility there. Like I said, you won't be able to do like deadlifts and squats properly if you don't have good mobility in your hips. And then again, like usually the biggest cause, which leads me to my next point of back pain, is going to be coming from the hips. Like in my experience, the biggest reason why people have back pain is just because they have tight hips. And what happens when your hips are tight, it literally pulls your pelvis either like anteriorly or posteriorly or like forward or backwards. And that's what like makes your spine bend in a certain way. And that's why people get usually like herniated discs because their spine is like straight or like bent like this or like bent like that. And then that's like it's not designed to do that. That's why the discs tend to pop out. So making sure you have good hip mobility. Again, like these are pretty much you're probably gonna have to stretch. I'd really recommend foam rolling the quads. Like foam rolling the quads is the best thing to like loosen up the quads before you stretch them. And that's a good thing about foam rolling is it actually like loosens up your muscles more. So when you stretch them, you can get into a deeper stretch and get more range of motion. But yeah, back pain that can be caused is usually caused by the hips being too tight, but also the lower back pain be caused by poor upper body posture, which is like called the thoracic region. So if you're like rounded and you're sitting here at a desk all day, like as soon as you round forward, your lower back's gonna round as well, and that's like kind of what pushes the vertebrae out, and then people get like herniated discs or like compressed discs and stuff like that. So making sure you have good posture. Posture is key, guys. You need to freaking walk like you got to stick up your ass. I'm gonna say it straightforward. Like you need to be walking straight up, pull your shoulders back, stand up straight, stick your butt out. Don't tuck your pelvis in. Don't keep your back flat. Your back should have like a normal like curve like that. So there should be like a little curve in your lower back. That's how you know if you have good posture. I'll do a video on posture one of these days. I'm not gonna get too into that, but posture is key, guys. It's gonna prevent you from injuring yourself at the gym. If you have shitty posture, you're gonna get hurt. I can guarantee you that, and that's probably the biggest reason why I got hurt when I first started working out. So lower back pain usually caused by the hips, or it's going to be caused by the upper body, poor posture, poor lifting technique. Like if you guys are feeling squats and deadlifts when you're in your back when you're doing these exercises, you're doing them wrong. Like there's no way you should be feeling a deadlift in your back. And I know a lot of people have a problem doing this because guess what? They don't have the proper mobility to get into the deadlift position in the first place. So if you're not mobile enough, you shouldn't be freaking deadlifting because you don't have the mobility to get into the position, and you're just gonna hurt yourself. Deadlifts are not for your lower back, guys. Your lower back is not meant to do this motion. Your lower back is literally meant to stabilize your spine. So there should be no bending at all involved. That's why like crunches, sit-ups, and stuff like that, those are horrible exercises for your body. It's literally like just making your hip flexors tighter again, which is going to make your pelvis tilt forward or backwards, and that's going to cause eventually lower back pain or lower back like injuries. Um, Thoracic area. So when I talk about thoracic area, I'm talking about like thoracic extension, like being able to bring your chest up and not rounding forward. I know like if you're sitting at a desk all day, you're driving a lot, you're sitting in front of the TV, like these are all things that makes you so rounded, and that's why people have all these issues with like their body, their backs and stuff like that. Is because you're literally like your posture is so messed up from sitting down, which our bodies are not designed to do that, guys. Our bodies are meant to be like standing up for the majority of time, sitting down sometimes, and like sleeping the rest of the time. Uh, I know I just holy crap. Let me know if you have any questions. Let me know if I'm speaking way too fast and you don't understand anything I'm saying because I can slow things down so I can actually see you guys. But anyways, where was I saying? Shoulders. Shoulders. This is I would say like lower back and shoulders. That's where I've injured myself the most and I still deal with them because of injuries that I can't really fix, but I do my best. What's up, Rick? What's up, Jason? What's up, Mike? What's up, Penelope? Let me get stuff really fast. But let me know if you have any questions. Shoulders. Okay, shoulders is like one of the weird joints in your body because it's designed to be both mobile and stable. Usually the rest of your joints in your body are designed to be like either more mobile or stable, and they're usually like staggered. So like your ankles are supposed to be like stable. No, you're mobile. Your knees would be stable, and then your hips would be mobile. So you see kind of like how it interchanges. But the problem with shoulders is that they're so complex and they're very like weird that they're supposed to be mobile and stable at the same time. So the issue is you can have shoulder problems if you're too mobile and not stable enough, or if or you're just too tight and you don't have enough mobility, if that makes sense. So there's a lot of stretches that I do all the time because you literally you're gonna get tight, and it's like kind of like a constant battle of like when you lift weights, you need to kind of counteract that with stretching, because if not, you're just gonna keep on getting tighter. Because when you lift weights, your muscles get shorter and get tighter. But if you're not counteracting that, you're just gonna get tighter and tighter, and then eventually you're gonna hurt yourself. So the question, oh nope, question. All right, you shouldn't be feeling your shoulders when you're like doing bench presses and stuff like that. And the biggest issue, the biggest reason, the biggest injury, sorry, that people get with the shoulders is going to be the rotator cuff injuries, which is there's a bunch of muscles in the back of your shoulder blades right there that kind of like stabilize your shoulder, and they're really small. And the problem is when they get too outstretched, when you have bad posture, that's when they have a tear. So that's why posture again is super important when it comes to the shoulders. You need to pull your shoulders back, chest up all the time. Make sure those muscles are a little bit shorter and not lengthened, so you don't have any tears, especially when you're like bench pressing and you elongate them, they're more likely to tear. And that's like probably one of the worst injuries you can get. You won't like raise your arm anymore. Um, so many things I said. My brain is fried already. Shoulders, mobility. Obviously, you gotta make sure they're mobile first and then stable. So like some good examples of like some good mobility exercises for your shoulders would be like overhead banded shoulder distractions. And then a good thing for like you would be like a get up is probably like one of the best exercises for shoulder stability. And it's also like good for a lot of other things, but really good for shoulder stability. Um, the neck. All right, neck is something that I have a problem with because genetically I have big upper traps. I don't actually do any shrugs, which I recommend. Don't do shrugs, guys. It's gonna jack up your neck. Not worth the getting upper traps. But genetically, my mom has big upper traps, and so do I, and I don't do anything. But that's caused a lot of problems because what happens is it literally will try to stabilize your neck when it's not designed to do that. What's designed to stabilize your neck is actually the shoulder or girdle muscles, which I just talked about in the shoulder. Those little tiny muscles are supposed to stabilize your neck, but if you don't know how to, pack your shoulders is called, then you're gonna have, yo, what's up, man? You're gonna have neck pain, which is something I struggled with a long time. So you want to make sure you're, get a lacrosse ball, stick the lacrosse ball into your upper traps, and it will loosen up the muscle and kind of give your shoulder blades or the shoulder girdle muscles a chance to stabilize your neck. So it's really important, guys. Neck pain. There's also you should stretch your neck out as well. I mean, I'm not gonna go into that right now. And then last thing, guys, or real quick, elbow. So I'm sure you guys have heard of tennis elbow and golfer's elbow. Basically, when you get like pain in your elbow right there. Um, so people think it's just because like they're over, but really, though those things are caused by tight forearms. So your forearms, when they get really tight, they pull right here, and it makes it really tight at the joint where it meets, and then that's what's going to cause um, tennis elbow. So if you're experiencing like elbow pain when you're lifting weights, more likely than not, it's just because your forearms are too tight because you're overpronated when your posture. So when you're standing, if you're standing in the mirror and you can see your knuckles in the mirror when you're looking at yourself in the mirror, it's because you have bad posture. So that's a good easy test to figure out if you have good posture or not. Look in the mirror. If you can see the front of your knuckles at all, then you have bad posture because you're too anteriorly rotated. So your muscles are right and your forearms are too tight, your lats are too tight, your shoulders are too tight, and you're rotating forward too much. Woo! That was a lot. That was a lot. Okay. Yeah. I said I would do a video on injuries and treatment, and I hope you guys followed that and understood everything I just said because I just said a lot of things. Again, let me know if you have any questions. Let me know if you have any want me to clarify anything. I know it's a lot of information, and there's no way anybody would absorb all the things I just said. I just want to give you everything. You guys can like watch it again on the replay, and let me know if you have any questions. I'm always here to help, guys. Uh, yeah, if you guys don't have any questions, let me know what you guys want to see next in the next video. I'm always here to help. And if not, have a great weekend, guys. Happy freaking Thursday. I know what day it is this week. And